Contact tracing is an important disease control measure to prevent spread of COVID-19 and has been used for decades to prevent many infectious diseases. It's a process that begins by asking individuals who are diagnosed with COVID-19 about people with whom they've had contact while they may have been infectious. The infectious period for COVID-19 is 2 days before a person started having symptoms, or 2 days before their test result if they don't have symptoms. A close contact is anyone who was exposed to the person with COVID-19 during the infectious period, within 6 feet for 15 minutes or more over a 24-hour period. This could mean a series of brief, close interactions over the course of a day that add up to 15 minutes, or prolonged contact, such as with members of your family, household, or community. Close contacts are provided guidance on how to take care of themselves and prevent transmission to others. This guidance includes quarantine, monitoring symptoms, and getting a test for COVID-19. Close contacts are asked to quarantine for 10 days, which means staying home and not attending work or school during this time. Individuals in quarantine should remain physically distant from others in their household or suite, wear masks, wash hands frequently, and disinfect common surfaces. Contacts are also asked to monitor their symptoms. The symptoms that contacts are monitoring are very similar to the common cold. Contacts should take their temperature twice daily. Anyone in the Yale community who develops these symptoms should not attend work or classes. However, some people who develop COVID-19 may never develop symptoms at all. So that's why it's important to also get tested for COVID. Members of the Yale community can access testing through either a self-scheduling link if they have no symptoms, or by calling their healthcare provider, or the campus COVID resource line if they develop symptoms. Even if a close contact receives a negative test result while in quarantine, the quarantine period does not end early, and all the contacts need to remain in quarantine for the full 10 days. Those who test positive for COVID-19 through Yale will also be asked about workplace contacts. A low-risk workplace contact is anyone who shared an enclosed workspace with the person with COVID-19 for a prolonged period of time, even if further than 6 feet apart. Low-risk contacts do not have to quarantine, but they should monitor symptoms daily and get tested for COVID. Not everyone that a person with COVID-19 walks by is considered a close contact. If you don't hear from a contact tracer, it likely means that you don't meet the definition of a close contact or a low-risk contact based on the information provided by the person with COVID-19. If you do not receive a call from the Yale contact tracing team and you think you may have been exposed, you should call the campus COVID resource line for further guidance. At Yale, contact tracing is done by a team of professional, certified contact tracers who are available 12 hours a day, 7 days a week. Through contact tracing, we can break the chain of transmission and keep our community safe.